for staying with us. Cardiovascular disease is a term used to describe conditions that affect the heart or blood vessels. This disease is often associated with an increased risk of blood clots, which can cause damage to arteries in organs such as the brain, heart, kidneys, and the eyes. The causes of cardiovascular disease can be traced to the amount of sodium we consume in our food, such as salt, processed foods, milk, creams, and condiments like fish, sauce, amongst others. And the World Health Organization recommends reducing sodium intake to avoid the risk of cardiovascular disease, stroke, or heart disease. Adults should consume no more than 5 grams of salt per day, and children should consume 2 to 3 grams. You can prevent this disease by leading a healthy lifestyle, saying no to excessive sodium intake, eating fresh foods, using herbs and spices to flavor food, and reducing the consumption of processed food. Well, we have in the studio to discuss this a medical consultant and Chief Medical Director, Heritage Men's Clinic, Dr. Rasheed Abbasi. Good morning.
Good morning.
Good to have you join us. There are those who will ask the question, how does consuming salt relate to cardiovascular disease? What is the correlation? How does that even happen?
Absolutely, absolutely. Thank you for the opportunity. So salt, in its original way, it's not meant to be consumed. Salt is a preservative. Somewhere along the line, people discover that the more salt they put, the food gets tastier, and we start taking it. But the concern for us in physiology or in medicine is wherever salt goes, water goes. And where does that water end up? It ends up in your bloodstream. So that means the amount of work your heart has to do increases. And this heart is a machine, is meant to pump only 5 liters of blood. In you, in me, in little kids, it's 5 liters. So the more salt you consume, salt pulls water, the water goes into your blood, and the volume increases. So the machine is struggling, and that's where the word cardiac comes in. So when the machine is struggling, it's not able to pump enough blood into the vessels. When blood doesn't flow, it clots, and that's where we get into trouble.
Right, and but then there is also another school of thoughts by medical experts as yourself who say on the face level of it, salt is good, is good, but and they even go on to say now that advocating less salt could also come with some risks. So help us to marry both.
Absolutely. So in previous research, we realized that there are some people in our society that just have low blood pressure. They are hypotensive under normal circumstances. Hypo. Yeah. Their blood pressure is not normal, it's not high. And so we realized that the hypotension itself is not really good because your organs need certain amount of pressure. When your heart pumps, the kidney gets a quarter. So if your blood pressure is low, the kidney is going to suffer from that. So they advocated back in then to give a little bit of salt because we know salt will increase your pressure. But now, as we do all the time, we go back and review, we realize that even for people with normal pressure, consuming salt over time will lead to bad issues. And so that's why they came out recently in December, January, that salt is actually no-no.
Well, you see, this same matter has led people to discover things like sea salt, Himalaya salt, all sorts of salt, and they say, okay, these ones are better than some others. Talk to us. Is there a difference, and is one better consumed than the other?
Absolutely, and take my word for research is abundantly clear. No salt is good, especially when it comes to we black people. Why? Because we are full of melanin. Melanin holds on to salt. When it holds on to salt, it has to look for water. Just like when you put table salt on your table at home, give it a few days, it's going to melt, it turns into water. That water goes into your bloodstream, and again, it's a matter of numbers. The volume goes up, your heart struggles.
So none of that sea salt?
Sea salt, Himalayan salt, all those. They evaluated. None of them is good for you and I. Salt is not meant to be consumed. It's a preservative.
All right.